All right, welcome to this special broadcast. My name is Vineet Malhotra and you're watching A-List. Today we have two special people with us in the studio. Kshitij Ruhel, co-founder and chief growth officer, Digital Darwin, a seasoned leader with 15 years of experience. Kshitij has excelled in driving business transformation, strategic planning and mergers and acquisitions across diverse sectors. As a co-founder and chief growth officer at Digital Darwin, he plays a crucial role in shaping the company's strategic direction and growth initiatives. Also with him by my side is Mr. Rahul Bajaj, founder and CEO, Digital Darwin, deep tech expert and alumnus of FMS and BITS Pilani. Rahul Bajaj is leading change in AI innovation and business transformation. As the founder and CEO of Digital Darwin, his innovative thinking has not only driven large-scale tech solutions but also built future-ready companies, always ahead of the curve. Gentlemen, thank you so much for being here. The first question, Rahul, I'll come to you. What is healthmates.ai and what problem does it fundamentally solve and resolve?
So, thank you so much for having us here, Vineet. Healthmates is a generative AI employee, if we could say that a person in a healthcare industry, there are health workers, then there are people who are working on a lot of administrative tasks which are required to support the running of an healthcare provider like a hospital or a clinic. These particular tasks generally are handled by either the doctors, are also handled by nurses or paramedics, and a lot of time from them goes into these particular administrative tasks, whereas their primary task is to take care of people, and that's where we divert or we reduce their bandwidth from what they should have been doing, which is primarily taking care of people who are in need. Healthmates works on creating AI employees who can do everything that a human employee can do in these particular administrative tasks, and hence relieve them from all these particular responsibilities and put them back on the care part of it, what their major or their primary role is.
All right, that's amazing to know. Kshitij, how does healthmates.ai work in the real world, so to speak, in a hospital setting?
So, okay, imagine it this way. When you go to a hospital, right, you will have somebody who will receive you at the reception. After that, you'll have, physician assistant of the doctor. There'll be a nurse involved. And then eventually you'll see a doctor, you'll have your consultation, you'll come out of the hospital. That's your typical OPD setting, right? Before this, outside the hospital, you would have given a call to the hospital to book this appointment. And after your OPD is done, you would get a call from the hospital, maybe asking you how the appointment went, whether you're taking your medicines or not. So those are the three basic facets, right? Pre-visit, at hospital and post-visit. Now in this entire journey, your care continuum, what you went for was the doctor and the nurses, and everything else around that is the support system, right? So they are the sun and everything else is the planets, and you're just traversing through this entire system. While you're traversing through the entire system, these suns, your doctors and nurses, they are pulled in multiple directions for admin activities. So a nurse would need to pick up a call, maybe to ask you, your call about booking the appointment. A doctor would be filling notes, which is required from a care continuum standpoint, but both of them are there to provide you the care. What happens is all of these ancillary roles, which are administrative in nature, they take up key time, and the only way of increasing in the constrained manpower the healthcare sector has in India and globally, there's a WHO stat which says that globally we are short of about 7 million nurses and healthcare staff. In India, that's about 3 million staff. So to take care of that shortage, you need to maximize the time these people are giving to care, not to administrative workload. Healthmates AI exactly comes out there. It works on those administrative tasks like an AI employee, not just a agent or a bot, but like an actual virtual employee. Takes care of those tasks, those workflows end to end, outcome oriented, and gives the nurses and doctors all the time they need for the care of the patient.
Well, that's fabulous to know, and it's quite groundbreaking, I must say, Kshitij. Rahul, what is unique about HealthMates.ai compared to other healthcare AI solutions is going to be the big question, right? That you also perhaps are used to.
Sure. So, what HealthMates does is that based on the data that is collected in a healthcare setting, there are a lot of solutions that create data collection mechanisms, etc. And there is huge amount of information that is collected when we are going to a hospital. There are vital statistics that are taken. Then there are some interview questions that are done before even we talk to the doctor. That could be done by a nurse or by the doctor themselves. And then after talking to us, the doctor writes a prescription. And after the prescription is written, then there could be some follow-up details. Now, all this particular information data sits in different pools. And what other healthcare solutions do primarily are looking at digitizing these particular things, bringing that particular information maybe in a digital format, but they still remain in pools. What HealthMates does is it thinks from a human perspective. So it has that cognitive capability where it looks at what the person who is looking at that particular information, how would they make sense out of it, be it a clinical part or it could be an administrative thing, but how would the humans would like to read that particular information. It is like also like a CMO, which is a chief medical officer, or a CEO or a CEO looking at that particular data and asking someone to come and sit and analyze that data so that they could answer those specific questions for them, for the hospital executives. HealthMates thinks from their perspective, looks at that particular data, and this could be data sitting in different pools, but combines all that particular data and starts answering those particular questions in a very human conversational way, right? So you ask a question, it can answer that particular question to you. If you are looking for a discussion with a patient, then what would be the kind of questions that a patient would be asking? For example, a prescription is written, the patient goes back home. A very common thing that happens is they didn't understand what exactly was written in the prescription. How is the medicine to be taken? Is it twice a day? Common problem, right? So is it to be taken twice a day? It is to be taken after meals, before meals. So what do? They pick up the phone, they try and reach out to the doctor. Doctor is generally not available. They are either in their OTs, they are in their OPDs. So they can call a phone number. Who picks that particular thing up is an AI employee. And an AI employee, in a very human conversational way, can answer all their questions because it has access to their prescriptions, it has access to their health records.
Fabulous.
And they would not even know that they are speaking with a non-human
entity.
person. Yeah.
That's fabulous. That's groundbreaking. And Kshitij, what inspired you to create HealthMates.ai? Did you feel that there was an actual void, or do you think there's a wave of AI? We need to be a part of it. What was the inspiration?
So both me and Rahul have had quite a long work experience here dedicated to healthcare sector. Both of us have worked in hospitals like Fortis and Continental and Max and others. Both of us had worked in IT sector in healthcare. I used to be working in Tech Mahindra at one point in time. Rahul was working in Sutherland and others. So having been through the setting in which you've actually seen the hospital operations running in front of you, you've seen the pain of the physicians in which they are pulled in multiple directions, pain of the nursing staff in which they're pulled in multiple directions, which does not have a direct factor upon the patient care. That really sort of talks to you in the gravity of the situation that we exist in right now. We've all remember this COVID period, in which having 20 minutes of doctor time was critical. Having 20 minutes of the nursing time was critical. And in that entire duration, they wanted to give their best, but they also had these other tasks which they needed to do for the hospital to operation and function. That's where the real inspiration essentially came from. How can we So we can't create doctors overnight. We can't create nurses overnight
Sure.
as a nation or globally. But what we can do is we can, give back the time that they need for clinical tasks, and take the administrative tasks from them and give it to systems which can handle it seamlessly, just like a human employee, just like a human being. And that's where the real inspiration for healthmates.ai came in, creating healthcare AI teammates, so health mates, and essentially those will do these non-clinical, non-diagnostic tasks, which other employees may be required to do, but nursing staff and doctors can be pulled away from it and they can focus back on patient care.
Fabulous. And Rahul, what were the biggest challenges in developing and launching healthmates.ai? What did you have to contend with?
So, healthcare itself is a difficult industry, one, because understanding the way healthcare works, what information is required in healthcare, getting the details of how the patients would be consuming that particular information. One that particular this particular part itself is a challenge in itself. Secondly, also it is a kind of to an extent it's a laggard in adopting technology as compared to, let's say, a finance industry or some of the let's say even edtech today. These are areas which have adopted technology much faster. So making sure, one, that the technology there remains in the back, it becomes the complexity goes in the background. These for the clinicians or for people who are using it, and also for patients who would be using this, the technology is not existent for them. It's only a very human kind of an interface for them, which they interact with, and they can simply get their solutions rather than having any technology jargon. That was our primary challenge.
All right. Last question to both of you. Kshitij, first up, I'll ask you. AI in healthcare is a very sensitive topic. How do you ensure trust and compliance? And where do you see your company and your initiative in the next 5 years?
So I'll cover the first part first. You perfectly spoke. Safety, compliance is paramount and critical when it comes to healthcare. Not just because of the laws written, but because you're talking about human life, right? And when it's at its vulnerable stage, you're always vulnerable when you're going to a hospital. There's something that you want to recover from. It's not a walk in the park. But from that perspective, there are multiple safeguards that we have put into the system. The biggest one actually is one of the most counterintuitive one, if you think about it, because we're creating AI employees, but the biggest, safeguard is if there's something in which you are not confident, the system is not confident, it's going to relay it over back to a human being. It is not going to take a call just because it has to. That's the biggest safeguard. Then beyond that, there are multiple safeguards. There's medical knowledge where it is trained upon, meticulously fine-tuned upon, essentially meaning that it can't just go left, right, and center. It's going to be focused on what it knows, and if it doesn't know something, unlike humans, it won't faff its way through. It'll just say, I don't know it, and I'm passing it on again.
Okay.
Those are the two big ones, but there are multiple technical guardrails that have been put around it. But from a normal user perspective, those are the big ones. As far as where we see ourselves in 5 years, we can use a statement used by every other startup of XYZ dollars and everything, but no, that's not the goal and the aim out here. The aim out here is right now, as I said, per the last WHO survey, India has shot about 2.93 million healthcare staff. We would like to ensure in the next 5 years that even if the shortfall doesn't come down from the current number, the care is enhanced by at least 2x, 3x in this country. And that can only happen because of technology.
All right, we have a paucity of time. Rahul, same question for you, and if you can wrap up with your thoughts.
Sure. So what we look at is that how the power of technology can actually be given to the last mile of healthcare delivery. When it is being done in hospitals, within the hospital settings, then how the error rate can be reduced, how when the nurses are working and probably there is a change in the shift, how all of that particular information could just happen at a click of a button, rather than doing the traditional way of writing notes, etc. When this particular technology is given in the hands of even in the hands of someone like ASHA workers who are going and working in the ground level in the hinterland, then a smart technology can actually make them much more potent in delivering those particular health services, because they'd be able to record what's happening with the patients and report it much faster, even arrange for the right kind of healthcare services right at the doorstep of the people.
That's wonderful, and then this sounds like not only exciting, this sounds like a groundbreaking initiative in technology, which is in fact going to minimize human error, and it's going to expand human trust in terms of what AI can bring to the table when it comes to solving medical crisis and challenges. Guys, thank you so much for being here. Kshitij, Rahul, appreciate you took out the time and spoke to us. Thank you so much.
Thank you.